This morning, dealing with dry, cracked skin in the wintertime. Tia Trudgeon joins us live from Medical Acne and Skincare in Marquette for a conversation about taking care of skin during the cold winter months. Good morning again, Tia.
Good morning, Elizabeth. Yeah, we're talking about wintertime foot, which is not technically a medical classification, but it's a syndrome that I feel like we kind of all experience. Really dry, cracked, calloused heels, toes on our feet. But actually, this affects adults and kids a little bit differently, according to Dr. Greg Sulik here. So we're going to break that down between kids and adults. So for kids experiencing really dry, cracked feet, why is this a problem?
Well, kids tend to they get painful kind of cracked scaly skin. It's not as dry and thick as what adults get, and the kids that get this is more like a form of eczema. It's often induced by their sweat. What happens in the wintertime, kids put on their socks and their little boots and they run to school and they stay in those boots and those shoes all day long with their sweaty feet, and so there's literally a disease. It's called sweaty sock dermatitis. If you want to call it a disease, it's a syndrome. I like SSS, sweaty sock syndrome. I think of the goose steps from the SSS in Nazi times. So, but what happens is these sweaty feet stay there all day long, and that sweat actually induces a form of eczema. So they get a painful form of eczema. And so really the best thing kids can do if they have that problem, not all the kids have that, but the kids that are prone to eczema tend to get that, is go to school and change your socks and change your shoes.
So parents should be sending their kids to school with an extra pair of socks.
If they have that problem. And you got to take them seriously. If they say their feet hurt, it probably really does. If you look at the bottoms and they're red and scaly, they tend not to get so much the fungal infections like adults get. They don't get that thick callous skin like adults get, but they definitely get a form of eczema. And I don't know what the exact percentages are, but I've had to write notes for kids for school that they have to change their socks as soon as they get to school.
Are there any medical solutions to this problem for kids, or any lotions, topicals that they could use?
So there are some over-the-counter things you can do to prevent it. And of course, the most important thing you do is prevent the problem in the first place, and that would be get to school, change your socks. Dry socks. And then when you get home, same thing, change your socks. Make sure your feet are dry. So, but then sometimes, because it's a form of eczema, sometimes we have to go to like topical anti-inflammatories, topical steroids, and other types of medicines like that. But the over-the-counter things to help with the scaling and the fissuring are the same things we use for adults, and these are available over the counter. You're just not going to see them at the source. Sometimes you have to go to the pharmacist and ask for these because they look more like something you'd get at the paint department in the hardware store, because one's ammonium lactate and the other one is a urea cream. But those help break up those scales and that thick skin that gets built up.
Alrighty, that's all the time we have for right now. So when you're looking for ingredients, look for ammonium lactate and urea. Those will help with the scaly, callous skin on the bottom of your feet. We're going to continue this conversation to talk about some of the symptoms and treatments for adults experiencing extremely dry, cracked feet in the wintertime.